Thank you, Janet. It's a busy day here, so thank you for coming and checking out what I have to say. I know there is a wealth of information and opportunities at so many seminars, and often they're at the same time. So by no means, if you're trying to catch 2 or 3 at once, I understand if you get up and shift. I would do the same thing sometimes too. Thank you. So today we'll be talking about a women's garden, of course. And I am Dr. J.J. Purcell. I'm a naturopathic physician and an acupuncturist who started off my career in herbal medicine in my early 20s. I'm inching towards 50, and I can say that the use of herbal medicine has really supported my life in all phases throughout it. So the first half of my life, when I saw this picture, my mouth would begin to water, and I would often think about what my next meal was. Now, all I see is medicine. In this picture, there are common household spices, all of which have medicinal value. Ginger soothes an upset stomach and helps to relieve aches and joints. Turmeric is a natural anti-inflammatory agent. Cinnamon has proven to reduce cholesterol, and the studies of the American Botanical Council show sage improves memory and concentration in both elderly patients as well as younger students with ADD. But before I saw this picture, as I do now, I had to learn a few things. Well, actually a lot of things. This doesn't seem to be working. Well, let's try the old-fashioned way. In my early 20s, a time when we should all feel young and vibrant and well, I did not. I looked quite normal on the outside, but often on the inside, I was miserable. I had headaches almost daily. My stomach never felt right. I was tired all the time. I was foggy. I had no menstrual cycle. And despite all of this, I kept being told, you're young, you're vibrant, there's nothing wrong with you, nothing showing up on a lab test, you'll be fine. And that was very frustrating for me. Sorry, I'm having a little technical difficulty and I'm not sure what is happening up here. So let me just try to reset this. There we go, I apologize. So I began to seek outside help. I started with my family physician, and then I went to nurse practitioners, I went to Planned Parenthood, I went to about anyone that would listen to me. I ran all sorts of tests, they all came back within normal limits, and usually with the same response. Again, you're young, or try this medication, or don't worry about it. And that was very frustrating for me. So over the course of 3 years, I was prescribed antidepressants, oral contraception, thyroid medication, various stomach medicines, Clomid, Anaprox, and again, a lot of don't worries. None of these options made sense to me. I was trying to determine why I felt the way that I did. I wasn't looking for something to force my body to act a certain way. I wanted it to perform naturally. I wanted to feel good naturally. I wanted to remind it of its own natural rhythm and its abilities. In this day and age, we are very blessed that we have incredible modern advancements in Western medicine. I am 100% sure I would not be alive today with the birth of my first child without them. But we also, as you might have seen on the cover of Time magazine recently, that alternative medicine is now considered mainstream. So we have this plethora of pools to pull from. But that being said, we are still in an age where we have to advocate for our own health. And we are often challenged by practitioners when we ask questions or when we have certain concerns about the prescribed method of treatment, and we get a lot of backlash. And so I'm here to encourage you to keep pushing through that. You have a right to ask questions about your treatments and about your protocols. You have a right to choose your own treatment plans. And so I encourage you to believe in that. Okay, so after some time and doing some research and starting to advocate for myself, I decided to take responsibility for my own health and what felt right to me. And this is the treatment plan that I self-prescribed. I stopped smoking. I'd been a casual smoker since a teenager. I changed my diet. I grew up in the Midwest, a lot of meat and potatoes, and it turns out my body doesn't really like meat. I decided to get intentional about exercise. I found an acupuncturist. In the state of Nebraska, you had to be a licensed MD to practice acupuncture, and we had one at the University of Nebraska in Omaha. So I drove 1 hour each way to see him. And 3 days after my first treatment, I did not have a headache for a week, and I got my first menstrual cycle within 3 years. And it was profound. I also really started doing research on essential oil therapy and realized quite quickly that there's a lot of trial and error with essential oils. And even though these medicines are readily available, they need to be used with caution and care. And then I started to study herbal medicine. And this protocol and me advocating for myself not only changed my health, but it really changed the trajectory of my life. So I dove in headfirst with herbal medicine. I started reading everything I could find. And this is where everything clicked. It was the first time in my life, having gone to college, studied biochemistry and English, that when I read something, I retained it and it felt normal to me. It almost felt like I was remembering information that I already knew. I didn't have to reread material. It made sense and it worked. And it was actually quite easy to understand and comprehend and put into my life. So if you read any historical texts on herbal medicine, you'll know that we have imagery dating back to the Paleolithic era talking about the use of herbal medicine, and we have written documentation back in the Sumerians of up to 5,000 years ago. Just because something is old does not mean it's outdated and it's unuseful. So today we're going to be talking about a women's garden and the herbs that can support a female body. And I just want to have a little clause here that when I talk about a woman's garden and I talk about a female body, it's very challenging to talk about a woman's body and not be gender exclusive. So please forgive me. I'm talking about female anatomy. And so anyone who has the female anatomy, this talk is for you. So today we'll be talking about 5 main categories: tonics for overall support, stress adaptogens, sleep support, the liver, because that's really important with hormonal health, and of course the heart, because the heart and women is important to make sure that we're taking care of ourselves. When I talk about the gardens, we'll be talking about 3 main phases: the maiden, the mother, and the crone. As you can see, my daughter is the maiden, myself is the mother, and my mom is peeking up out of the back there. So a maiden is pretty much from menarche until reproductive years. Now consider if you don't have children, then you kind of stay in this long arcing from maiden to menopause. There are major changes in the reproductive hormones, in the hormones when we have conception of a child. So that is considered the mother phase, because those hormones do adjust both with conception and after delivery. And then the crone, of course, is later perimenopause and menopause. And I apologize if you are not comfortable with the word crone. I consider it an honor. I think it's a really valuable time and title in life. So that's my opinion. And I'm about to be there, and I'm very excited. So the first plant we're going to talk about is Vitex. Though very hardy and thrives in the Pacific Northwest, it's very slow to leaf out, and it often looks like a dead tree in the early summer before it begins to leaf out. So Vitex comes to its own in later summer, entering in the fall, which makes it a really nice area of interest in that time of year. So this is Vitex, which we're going to talk about here in the minute about how it affects hormones specifically, is wonderful pretty much for every phase of a female body. It works on the emotional components, it works on irregular cycles, bleeding irregularity, headaches, and pain. And pain, I'm speaking of discomfort around cramping either before, during, or after your menstrual cycle. So let's just talk a little bit how Vitex actually affects your hormones, right? So as you can see up here, one of the main problems that typically occurs, again, not everyone is going to be inclusive in all of these slides and what the information I'm saying. I'm talking in generalities here. When I run tests, this is the most common thing that I see. Low dopamine tends to be the starting point of what is happening. That leads to high prolactin in the body, which leads to low luteinizing hormone, which is supportive in ovulation, right? Which leads to low progesterone. Vitex studies show it increases the dopamine, which forces the prolactin to go down, which increases the luteinizing hormone possibilities, which of course then helps to secure ovulation, which then of course raises progesterone. So low dopamine can lead to high prolactin, like I just mentioned, and low progesterone as the end result is a myriad of symptoms. Mood swings, anxiety, depression, hot flashes, irregular menstrual cycle, weight gain, fibroids, endometriosis, thyroid dysfunction. So you have a lot going on to consider when your dopamine or your progesterone is low. So we use the berry. They're easy, just when they're about to turn brown at the end of the berry cycle is when you pluck them from the bush, and that is the time to harvest. Vitex is also considered estrogen receptor sensitive. What does that mean? It doesn't mean that it raises the overall estrogen level, but it does have phytochemicals in it that actually help to balance out the estrogen along with the progesterone in the body. So adaptogens by nature raise what is low and lower what is high to create balance in the body. I'm not sure if Fred is still in here, but I'm having some problems, so I can't access some of my notes to talk about the studies. But basically, studies based out of New York and another one based out of, and I can't remember because I can't see that small. What's it say there? I can't see. But is proving to show clinically effective against PMS and menopausal symptoms such as depression, irritability, anxiety, and nostalgia. You can ingest it in a tea or a tincture or a capsule. You know, the big thing to remember with herbs is they don't work unless you take them. And so you have to decide how you're going to be compliant with taking them. Some people like just to take a pill, that's easy for them. Other people have a daily meditation and want to make a tea and they want to drink it every day. So the next one we're going to talk about here is shatavari. And shatavari is an incredible herb. It grows in hardy zones of 8 through 12, so fine here. The root is the medicinal part, and the plant prefers south or west exposure in deep, rich soils. The best pH for growing shatavari is barely acidic. So shatavari balances production of adrenal cortisol and contains compounds that are precursors to progesterone. One study, it boosted production of gonadotrophin-releasing hormone, which I'm going to show you that process in a minute, which then creates a cascade downfall of luteinizing hormone, follicular stimulating hormone, and progesterone. So it's considered a rejuvenative tonic, and it's got some wonderful minerals and vitamins in there. Vitamin A, B1, B2, C, E, calcium, and folate. So let's just take a quick look at this so you understand when I'm saying these words, what they mean. So up in the brain, we have a little signal that releases gonadotrophin-releasing hormone. That's GnRH. That talks to the anterior pituitary. It releases luteinizing hormone and follicular stimulating hormone, which are the two hormones that work with ovulation. That goes down to the female ovaries, also to the male testes, but in our case today, we're talking about the female ovaries, to create the rest of the hormone cascade, estradiol and progesterone. So shatavari, as I mentioned, stimulates that gonadotrophin releasing hormone so that the rest of the cascade can occur. One more of these, because I think it's important. So let's just take a quick look at this. These are some of the pathways that occur in the body. And the reason I'm showing you this is because one thing is always dependent on the next. And if you don't have the thing happening before it, then the thing after it isn't going to happen. So here we show cholesterol, it creates pregnenolone, which creates DHEA, which is the building block of pretty much all sex hormones. But pregnenolone goes to progesterone. Well, see, as you can see there, it also goes, progesterone can go one of three ways. So it's getting pulled in multiple directions, right? Well, here's what I have to say. If you have really high stress or really high cortisol, progesterone is constantly stolen to make cortisol. It will shunt to cholesterol all day long before anything else. And that's mainly because cortisol is necessary to survive. So if we get into a serious trauma, like a car accident or a drowning, cortisol is pumped through your body to try to maintain survival. So at some point, if you've had long-term stress over time, your body's been pumping out cholesterol constantly. That shuttle is going to be first nature. It's going to go right to cortisol, and you will no longer make anything else along that pathway. So we consider Shatavari a reproductive tonic, wonderful for menstrual cramps and balancing out that discomfort. Of course, a fertility tonic because it's supporting the ovulation cycle. Menopause systems, it's also helpful for sperm production, and it's traditionally called an aphrodisiac. So in the Middle East, this herb is known as the wife of 1,000 husbands because she's so virile and ready to go all the time when she takes it. If only that were true. So the next ones we're going to talk about are peppermint and chamomile. There is no clinical studies shown on what I'm about to show you or tell you. All I have are my own clinical cases as well as my colleagues while we were in grad school. But what we found is a really simple protocol. And I have to tell you, if I can find a simple protocol, I will always start there first, because your body often just needs a little nudge versus a big punch. And if you can start with those little nudges and those consistent little nudges, the body typically will catch on. So this protocol is basically peppermint tea, a cup of peppermint tea, days 1 through 15 of your cycle. Even if you're not having a cycle, you can just start on, use the moon. That's what we would recommend a lot of times with anovulatory or amenorrheic patients. So for the sake of this conversation, we'll say day 1 through 15, you drink a cup of peppermint tea. Day 16 to day 1 of bleeding, you drink a cup of chamomile tea. This tends to have an effect on both the folliculating stimulating hormone and the luteinizing hormone and creating balance within the cycle. I've seen a handful of amenorrheic women start their cycles with this simple protocol. So peppermint also is studied to and known to relax smooth muscle. So as you know, the uterus is one big smooth muscle, and often it is cramping like crazy to dispel during the menstrual cycle. And peppermint is really helps that smooth muscle relax, which is a nice thing. The Department of Epidemiology and Biostatistics did a comparative study of peppermint and dysmenorrhea, with emphasis on pain and severity, and it was concluded that taking peppermint greatly reduced both. So think about this in the larger picture. We have smooth muscle throughout our whole body, so how else can we utilize peppermint in such a simple way as a cup of tea? Chamomile, of course. Another study recently published in December of 2019, they did a study of emotional effects affecting both women of fertility age and menopausal women, and chamomile proved that chamomile possessed anti-inflammatory, antispasmodic, sedative, and anti-anxiety properties, and had a significant impact on reducing emotional imbalance, as they've referred to it in the study as psychological problems, which I don't really agree with, in the women of PMS and menopausal emotional upset. So this little flower that we think of as kind of benign has really strong medicinal potential. Some folks will be allergic to chamomile, and often that's because it's harvested with ragweed, and the ragweed is in the same batch as because it grows right next to it, and often it's confused, and so they just put it all into the batch. And so, well, almost all of us are allergic to ragweed, and then it'll get confused. So if you think you've tried it before, I really encourage you to find a really credible, good source of chamomile and try it again and see what happens. Next, we'll talk about stress. According to the latest research, the average human body is 20% water and 80% stress. Americans, we love to stress ourselves out. We are really good at it. Our environment is stressing us out. Our lifestyle and pace is stressing us out. This enormous importance on achieving or fitting in it's a huge stress in our lives. And so the need to balance that out is really important. And I'm going to show you how stress affects the body here in a minute, but we're going to talk about, again, there's a lot of herbs out there. I'm just picking and choosing some for this lecture, but we could go on about different herbs for stress and all of these other topics. But for today's conversation, we're going to talk about holy basil, ashwagandha, and rhodiola. So let's talk about the adrenal glands. The adrenal glands are these two little glands that sit above your kidneys, right back here. And the adrenal glands do a lot of things, but they do three main things. They balance blood sugar, they control inflammation, and they also help support emotional stress. So if you're not eating regularly and you're having a lot of ups and downs with your blood sugar, and you're noticing getting dizzy when standing, getting really tired after you're eating, these kinds of things, that could be a blood sugar imbalance. Cortisol is being pumped out to support that process so that you don't pass out, right? If you have an injury, chronic or acute, let's say you fell off your skateboard as a kid and you never really took care of it, and now as an adult your knee kind of aches from time to time, well, you have a chronic injury, which means a chronic inflammatory reaction, which means the body is secreting cortisol to try to keep that inflammation down as much as it can. Then if you have a lot of stress in your life, let's say it's situational, you're going through a breakup, you have a really hard project deadline to meet at work, or a long-term family stress marker in your life, then cortisol is also being released to try to keep you functioning and compensating. So if you have any one of these three things happening, or all three happening at the same time, cortisol is being pumped all the time. And at some point it's going to say, I give up. This is the way you want life to be, so I'm going to stop making cortisol. Well, then you're really in trouble, because your tank of cortisol goes really low and it holds on to that because it's like, I know I'm going to need this if I really need it, like I mentioned at some time, like with the trauma. And so then inflammation gets really high because it's no longer being controlled. Your blood sugar gets really out of balance because it's no longer being controlled as well as it used to be. Stress gets really high. What's the end result? Insomnia, anxiety, lack of appetite, these kinds of things. So again, as you can see here, what suffers is that everything gets shunted to cortisol as first, so the rest of the hormones kind of get left behind and you get imbalances. There's a great article I really encourage you to read. It's called The Mind and Mental Health, How Stress Affects the Brain. There is the reference. Just so you all know, all of these slides and this presentation will be on my YouTube channel. So if you want to refer to anything later, you can go there. I'll have the slide presentation that you can just download yourself. You can also rewatch and hear anything that you want to rehear later. So definitely encourage that. So the highlight of this states, high levels of cortisol can wear down the brain's ability to function properly. According to several studies, chronic stress impairs brain function in multiple ways. It can disrupt synapse regulation, meaning how they're firing and connecting and talking to each other, resulting in the loss of sociability and the avoidance of interaction with others. Stress can kill cells and even reduce the size of your brain. I don't want that for any of you and me. So let's take some herbs. So importance. Stress reduction allows for brain function and endurance, meaning you'll have more energy throughout the day. You'll be able to compensate for the physical and emotional aspects of your day. And recovery. If you happen to hurt yourself, you're going to actually have a fighting chance to repair that and move on from it versus ending up in chronic pain. So the first one we'll talk about is Tulsi, holy basil, the incomparable one, the mother medicine of nature and the queen of herbs. I mean, with a name like that, let's all jump on board. It's a half-hardy annual. Holy basil grows in well-sheltered on a sunny you can even grow it in your apartment, in your house, on a sunny windowsill or in a greenhouse. But it can be grown in a in a sheltered spot outdoors in zones 7 through 10. This is another article which I really, again, if you want to dive into all of the benefits of how it manages stress and and also immune system. I really encourage you to check this one out. Many of the psychological effects of Tulsi can be attributed to its ability with the body's internal housekeeping and protection of the body's toxin-induced damage. So when stress goes up, what do we have a lot of? We have a lot of free radicals going through and damaging cells, and then toxicity levels also increase in the body. Holy basil not only helps to protect our cells, increasing our overall immune resistance, but it also helps clean out overload of toxicity levels, which occur when we're at lower resistance. So besides stress, helps to fight the common cold, promotes oral health, so really great for a rinse, gingivitis, or any kind of infection or soreness that's going on in the mouth. Eases inflammation, protects the heart, nourishes the skin, relieves stress, as we talked about, and alkalines the body.
Would any basil be okay?
No. Holy basil. And here's the thing, there's 3 kinds. There is Vama, Rama, and I can't remember what the other one is, starts with a K. And they're all studied across the board pretty similarly.
Is the best way to take it fresh?
No.
Put it in salads or whatever.
Well, you can.
And cook with it.
I mean, anytime you can eat an herb, I am all for it.
Sure.
Yes.
What are the other, what might be the other
Tea, tincture, capsule.
Okay, great.
Yep. Oh, yeah.
Does it taste like licorice?
Yeah, I mean,
Okay, then it's a darker purple leaf.
yes.
The one I had, it's a darker purple leaf.
Yes, and you could have had like a Rama variety.
Delicious.
It is delicious if you like licorice. Not everyone does. All right, so the next one we're going to talk about is ashwagandha. There is a wonderful farm in Portland. I'm from Portland, called the Portland Ashwagandha Farm. They make incredible medicine if anyone's looking for a good resource. They also do sell their roots in early summer or spring. I can't remember, at the farmer's market down there. But it grows in zone 7 and cooler as an annual, but in 8 and 9 it can grow as a herbaceous perennial. Its leaves and woody stems are killed off by frost, but as long as the soil is not overly wet, the roots remain vital and it'll sprout new shoots every year. And the root is the medicinal part that we use. So it combats stress, again, works with the adrenal glands to help that natural cascade. It also helps thyroid if someone's working with thyroid, specifically subclinical thyroid. If you're the person who's read all the books, you're like, I have thyroid disorder, but no one will tell me that, everyone tells me that my labs are normal. You could have subclinical thyroid. What is subclinical thyroid? It basically means that you are trending towards thyroid disease, whether it's hyper or hypo or Graves. And that is the role of a naturopath, right? When we look at labs, we're looking at values. We're not looking at pathological values. We don't want you to be in that pathological range. We're looking at before and after, like to see what the trend is so that we can stop it before it actually becomes pathological.
I see that they ground that. They try to
Yeah,
ground it.
yeah.
And then is that turned into a tea then?
You can, typically that would be a capsule at that point. You can mix it with hot water and drink it, but I would recommend just using the root for tea. Yeah. So you guys are probably aware of cadmium in certain fertilizers and potting soils and things like that. There was a study performed that talked specifically how ashwagandha reduced toxicity from cadmium exposure. So the next one that we'll talk about is the rhodiola, which I can't see enough things. Does anyone grow rhodiola here? Oh, that's fun. And you grow it back there. That's great. So as you know, the root itself, it's the root or the root bark. It has a wonderful rosy smell when you harvest it. It's lovely. It thrives in all hardiness zones and grows naturally when temperatures, even when temperatures dip below freezing. It's a medium-sized succulent plant, and it's related to the stonecrop and to jade, and it'll get these pretty little pink, white, or yellow or red flowers. Really pretty. I'm not going to dive into this too much, but basically, again, it's talking about the brain and how, yeah, we won't go there. Okay, So herbs, I'm a biochem major. I love chemistry and schematics, so I get really nerded out sometimes. Anyway, herbs for sleep, and I love jokes. Insomnia is very common. Try not to lose any sleep over it. Okay, so this is the fun part. This is when I show you kind of a weed, invasive, and all the gardeners go, ah! And then they think, why would I ever have that in my garden? Because it's wonderful medicine. California poppy thrives, of course, everywhere. And here in the Pacific Northwest, it comes back year after year. You can sow seeds directly outside when the soil is workable. And you harvest the aerial parts, everything above ground, leaf, flower, stem. It's sedative in nature. It's also anti-anxiety. I have had wonderful success with people who hold tension in their body, so much tension that it's really hard and uncomfortable for them to sleep. They walk around with their shoulders up here, and this seems to have a wonderful, I say seems to because I haven't found a study yet that has studied it enough. As you may or may not know, herbal medicine is just starting to finally dive into the funding pool for research. There's a handful of herbs that have been studied really, really well and over and over and over, leaving all these other herbs still remaining to be studied. In my clinical experience, I've used it for people who have a hard time going to sleep and a hard time staying asleep, particularly when there is muscle tension related in the body. This isn't necessarily going to work with the overactive mind as well as this one. Passion flower. Does anyone grow passion flower? Yay. I've only had a bloom once in my life. That means you're supposed to be friends. When an herb just like passion flower just enters your yard, whew, that's magical right there. So passion flower is an incredible central nervous system herb and really works well on sleep as well. So this is something that isn't going to be taken in the middle of the night if you wake up. If you're one of those people that wakes up and your brain clicks on, this isn't going to do that. This is more for you're going to drink a cup of tea an hour before bed, and it's going to help create sound sleep for you as best as it can. Now the next question that people always say is, if I drink tea before bed, I have to get up and go to the bathroom. I totally understand that. Drink the tea an hour before bedtime. So just like when we have a newborn baby, they cannot respond to verbal cues. So we have these routines for bedtime, right? So you give them something to eat. You put them in the bath. You put lotion on them. You put their PJs on. You read them a book. You cuddle them. You sing them. You put them to bed. And then they just fall asleep like little angels. But they do respond to those cues if you're consistent over and over and over. The physical body starts to relate and understand, oh, I'm going to sleep now.
Is passion flower related to passion fruit?
Yes.
Yeah.
Yes. So yeah, I was just in Hawaii. Yes. So the thing is that if you have the same kind of routine as an adult, which rarely any of us do, we're running around, we're watching TV, we're checking Facebook, we're writing speeches, whatever it is, we're doing all these things before bedtime. If you really want to institute healthy sleep patterns, then start putting yourself to sleep with a protocol every single night that is the same. Give your body cues of how to fall asleep, that it's time to unwind, it's time to shut down. Because if you're working until that place and then you're like, oh, it's time for bed, I better go to bed, and you turn off the light and then you lay there. It's like, well, it's going to take you another hour just to get to sleep.
How do you take them?
This is the same. So pretty much everything that I'm speaking of can be taken in a tea, a tincture, or capsule form.
So all flower and leaves, everything?
Yeah. Yep. So passion flower, of course, helps with sleep support, as it says there. It also does a wonderful job of anxiety. So if you're one of those people that tends to get worked up or gets uncomfortable feeling in your body, it does a wonderful job to support that stress, of course. And it also has been shown to be a wonderful support with withdrawal. Yes?
Just take the flowers and drop them in a
Well, when we harvest it, it's pretty much the aerial parts again, and then everything is cut up. So when you get passion flower, like if you buy it from an herb shop, it'll just look like a bunch of green leaves, right? But yep, so you would just cut the whole part, and then you can do it fresh, or dry it, and then make a nice little jar of it, keep that, and use like a teaspoon at a time in a cup of tea. Yeah.
Is there a problem mixing passion flower with California coffee together?
No.
Okay.
That's wonderful. Here's why that's okay, because you have the same intention with blending those two herbs, right? The same intention is to help you relax and perhaps promote better sleep. I mentioned it yesterday. What often happens when people start blending herbs is they think, oh my gosh, I'm gonna make a tea or a tincture, and I'm going to improve my sleep and cure my gas and take away my headaches and take away this pain in my shoulder. And you mix all these wonderful herbs in a tea, and then you take it, and the body doesn't know what to do with it because there's no focus. So when you're taking medicine, you want to have a very clear focus so the body knows exactly where you want it to go.
So do you need some time, a period between your different purpose herbs?
Like in a day or in a...
Yeah, in a day, like within an hour or outside?
Yeah, I wouldn't like line up your herbs and take one for your head and one for your liver and one for your heart, like all at the same time. Yeah, what I tend to recommend, and I did talk about this yesterday too, is I tend to recommend having I dedicate 1 month to my lungs every October. Every October before the winter season hits, I take a lung tea or a lung tincture to support my respiratory system before the onslaught happens. And then every March, I do liver. And I'm not purging my liver. I'm not like, we're going to cleanse you and, take care of, pull all the stuff out of you. I'm more like, let's nourish you now so that you can work better for me. I put intention into what I'm taking so that the body knows how to use it. If you're working on menstruation or ovarian function, then yes, I take 3 months, because whenever you're dealing with hormones, you're not going to have a quick fix in a month. The hormone cycle is different every single day over a 30-day period before menopause. Every day, it's at a different level. So if you think that you're going to correct an imbalance in 30 days, that's just not possible. You can do it with pharmaceuticals and force your body to have a reaction, but if you want to return that natural rhythm, you're looking at 90 to 120 days to really steadily nourish and get that rhythm back on course. That doesn't mean you're not going to see glimpses of things changing over that time, but to make it stick and stay, it's going to take a while.
Question.
Yeah.
You said that you dedicate a month to certain things.
Mm-hmm.
So in that month when you're dedicating it to your liver, do you still kind of take a little bit of this tea, passion flower, to help you sleep?
Like if it's part of my bedtime routine, sure.
Okay.
Yeah.
All right. So,
Yeah, I'm talking about the big focuses,
Okay.
to really focus on, concentrate. So, studies show that passion flower supports the GABA receptors, increase melatonin, increase, what does that say? Oh, the slow brain frequency waves. That's important to get into that deeper sleep. And just 1 cup of tea can have a positive effect. So let's talk about liver a little bit. So the hormone.
I have a question.
Oh, yes.
So if you do take melatonin and then you do passion
Mm-hmm.
flower, is that a problem?
Possibly. Yes.
Can we grow passion flower here?
Yes.
And where do we buy the seed or plant?
I would recommend finding your local seed exchange. Like in Portland, we have a big seed exchange that's coming up, and that's my favorite place. Okay, and we'll have time for questions at the end too, if more come up. So when we're talking about the liver, the importance of the liver is that this is where the building blocks occur, right, for the sex hormones. Also, if your liver is inundated with the detoxification pathways, so that's what the liver does, it's right? It's the master detoxifier. So if there's a lot needing to be detoxified in the body, it gets very distracted. And again, energy gets pulled from other places to focus on doing that versus doing some of these other important elements that need to be happening. If you're fat, but you're good fat. So just want to say that fat is not a bad thing.
That picture just before that, there was some foxglove or digitalis.
Yeah. No, it's just pretty.
Don't do that to me.
No, that's the heart. So this is another one. I hope you're not cringing, but milk thistle is considered invasive. I totally understand. But gosh, it works so well on the liver. And not only that, it supports the bees and the birds. This herb is so profound. It basically helps the healthy cells stay healthy so that you can regenerate more healthy cells. Do you know that you can lose up to 75% of your liver and regenerate it all back? Like, that's profound. The liver, I mean, when the liver was created, somebody knew what they were what they were doing, because it takes a hit and we can lose a lot of it, but we know that it's one of the most important organs of the body. So we can lose a huge percent of it and it will grow back. So it grows all around here, zones 5 through 9. And the bioactive component of this plant is known to reinforce naturally occurring liver function through antioxidant activity. So it's protecting those cells and helping more healthy cells come.
Again, a tea.
Yeah. Or powder. The tea is kind of hard. You'd have to boil it for a while because it's a hard seed. So just some highlights from the research that I found. Effective in stimulating function of the liver and cleaning lymphatic system. How to prevent cancerous growths. It helps to prevent cancer strokes in prostate and breast and cervix. Aids in managing diabetes. Lower risk of heart attack. Effective remedy against poisoning caused by mushroom. It's really handy to know. Useful in delaying onset of dementia and Alzheimer's, because the more that your liver is healthily functioned, then less toxicity occurs. The last one for the liver is chicory. Does anyone drink chicory coffee? Anyone from New Orleans? Woo! Yeah. It's a perfect thing. I mean, here you are with the amount of alcohol consumption that happens in a 10-block radius in New Orleans in the French Quarter, and then they get up and they drink coffee with chicory because it's in all of their coffee. It's brilliant. I mean, they're naturally like detoxifying the next day. That's right, you do. Well, it would be a sin not to. So detoxifies the liver, aids in digestion by maintaining healthy intestinal flora, which is really that. I don't have that citation with me, but I can, if you email me, which is on the YouTube, my email address, be happy to provide you with any of these citations. There's a study that just recently came out talking about maintaining intestinal flora, which, as we know, is the biome is more and more a hot topic.
Is that the seed that I'm seeing there, or is that?
Root.
Oh, that's the root.
Improves metabolism, enhances calcium absorption, also really important as we age. As you know or may not know, you stop absorbing calcium early into your 20s and 30s, so absorbing it is important. Reduces, the woman that talked to me about the heart, I was just doing some more research last night, and also this came up specifically for arrhythmia and fibrillation, so you should definitely check into that.
Excuse me.
Yeah.
Is this in your books?
Is this speech?
Like you're talking, when we're seeing these images and then we're seeing this, like these fun points, is this all in the book?
Well, I mean, my book is filled with lots of information similar to this, but this talk was created, separately.
Okay, so YouTube.
Yep.
Thank you.
Sure. So this is how to make New Orleans coffee. So basically, you're going to use a ratio of 1 part chicory to 2 to 3 parts coffee. And I recommend you try it. It's roasted root. It tastes really good. You can't even tell the difference that it's in there, and you're doing your liver a hand up. So we're going to talk about the heart here. Oh.
I had a question. Can you use that with something else, because I don't recall it?
Oh, yeah. You can just do it by itself. When I often recommend that, people are like, oh, no coffee. That's ridiculous. Yes, you can just drink straight chicory and it is delicious. It's like roasted coffee. It's like really roasty. That's the biggest thing when you try to withdraw from coffee, is that roasty kind of flavor. And sometimes people will mix roasted dandelion root with it too. And that's a good choice. So.
Well, chicory coffee, if you have this chicory, does that help with your liver?
Yes. So talk about the heart, of course. The heart is really important for women as we age. Whether we try as hard as we can or not, the heart it's our nemesis as far as pathology as we age. So hibiscus is a wonderful choice, and it's a beautiful thing to have in the garden. So it's native, of course, to tropical areas, but it will grow in zones 8 through 11, and as far north as zone 6, if it's started indoors and then transplanted outside. We use the dried flower, and it's really high in so many wonderful things, including vitamin C, of course, but also polyphenols, anthocyanins, polysaccharides, and volatile constituents that are beneficial for the cardiac system overall. Also works on really well on cardiac atrophy and hypertrophy. The other herbs that, of course, I recommend for heart health, that beautiful hawthorn, we use the berry, the leaf, and the flower. The berry is used for the overall muscle of the heart, and the leaf and flower are used for pressure and vasculatory circulation. Great choice. And then motherwort is there on the other side, which of course works on the heart and the liver connection. A lot of times there is kidney involvement when there's heart involvement, and supporting those two systems together can be really beneficial. Other herbs just to consider overall for a female anatomy garden would be red raspberry, maca, wild yam, rose, and mugwort. I mean, every garden should have a rose, I think, but this is just a little teasel plant, which is really good for cramping as a side note. These are the books that I have out there now. So some of you seem really interested in how to make this medicine, or how to, after you harvest it or you grow it, how do you harvest it, how do you dry it, how do you use it, how do you turn it into medicine. Any of these books will talk about that. The Herbal Apothecary is my first book. It's going to go really in depth. It's going to give you step by step how to harvest it, how to dry it, how to use it fresh, how to make tea, tincture, capsules, oils, salves. All of them will show that to some degree, but the Herbal Apothecary has the most in-depth. It also has 100 plants, where to grow them, how to grow them, when to harvest them. So it's the most comprehensive in that regard. The Women's Apothecary, of course, is going to do a deep dive into herbs for women's health. And then the Master Recipes is like an A to Z, and it's kind of my guidebook. Even me, I mean, I have a family, I have a farm, I have business. Sometimes something will show up and I'll be like, oh, what should I take? Stomach pain today. And I'll just, look at, oh, right, do that. Or, a runny nose comes through that's not like any other. I'll look at my recipe book. It's kind of an A to Z of day-to-day complaints.
Do you have those for sale here?
They are out there, yeah. Currently I'm working on Restoration Gel, working to change the standard of care for women after vaginal birth. I believe we deserve more than an ice pack. Currently, that's what you're given, ice pack and some ibuprofen, and take care of that baby. And I'm really trying to bring focus and attention back into the fact that this person just gave birth. They need a lot of care, and they need a lot of attention as well. And the Restoration Gel helps to heal the tearing perineum, pain and swelling that occurs with vaginal birth. And I'm doing a lot of research on that because the main ingredient, dun dun dun, is comfrey. And comfrey has a lot of negative imagery out there. So I am researching high and low, and if anyone has anything they'd like to share or contribute, please let me know, because I am destined to return comfrey into fair favor with the world. Thank you.